Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist we have provided almost all the topics in a very systematic order. You can make use of it, and as we are discussing in the last class, so today also we will continue with the same. So we have been discussing about some of the important MCQs which is quite useful for PG entrance exam and as well as some of the interviews. And basically all these MCQs are from Kashyapa Samhita, the rare questions. So today we will have the first question. The first question is, which of the following sentences are wrong or sentence is wrong? Kashyapa explains Kaumabhritya as the Adhya branch or most important branch, option A. Option B, Kashyapa explains the complication of excess Upaveshana Samskara for the first time. Option C, Agni of the child is stable during Kshira Annahada Avastha. And last one is, Kashyapa explains the sexual variations in severity of dentitional pain. So these are the four options. What we have to say is which of the following is wrong. When I say which of the following is wrong, probably the three options are right, one among them is wrong. Now we have to identify which of the one sentence is wrong. Kashyapa explains Kaumabhritya as the Adhya or the most important branch. Yes, this is the right answer. Option is right because Kaumabhrityam is considered as Adhya branch by Kashyapa Samhita for the first time. Kumaram Tantranam Adhyamuchyate. Okay, Kaumabhrityam Tantranam Adhyamuchyate. So he says that Kaumabhritya is the most important as well as the first branch. So first preference should be given to Kaumabhritya. Second, so therefore the first option is right. Second option is Kashyapa explains the complications of excess Upaveshana Samskara. Samskaras are explained by Kashyapa mainly, and some of the other authors also mention the Samskaras. In that also the Upaveshana Samskara is explained by Kashyapa only, and the question is whether he explained the complications of excess Upaveshana Samskara or not. Of course, Upaveshana Samskara is explained, it should be done on the 6th month. Now question is whether he has explained Upaveshana Samskara complications. The answer is first time Kashyapa explains the Upaveshana Samskara complications. Okay, the list of complications are there: Jarjarangatvam, Anghanam Katoratvam, then Jwara, etc. So then these spinal deformities, some of the kyphosis, scoliosis like conditions. So many complications of excessive Upaveshana Samskara has been explained by Kashyapa for the first time. He is the first author who explained this. Therefore second option is also right. Third one is, Agni of the child is stable during the Kshira Annada Avastha. Now this is again important question. We have to analyze whether it's the right option or wrong. And the last option, if you see, Kashyapa explains the sexual variations in the severity of the dentitional pain. Kashyapa is the first person who explains the dentition. In the dentition also he explains that the dentition in male and dentition in female baby. He clearly says that dentition in female baby is quite easier compared to the male baby, and in male baby dentition is always more painful because of the hardness of the tooth, and it is quite easy in case of female because of sushiratvat mrudutvat. Okay, dentition, that is dental lamina or what you say teeth, so that is quite mrudu and sushiratva in case of female. Therefore it will not cause much problem during the dentition, whereas in the male it's kathoratvat, stiratvat and kathoratvat. Therefore it is quite painful. So this sexual variation in the pain of the dentition is well explained by Kashyapa. Now last option which is left out is the Agni of the child is stable during the Kshira Annada Avastha. So is this right or wrong? Actually this is wrong because Agni of the child is unstable, very unstable during the Kshira Annada Avastha. Therefore child will have so many nutritional problems, or child will have so many digestive problems. So child is not able to accept so many types of the food, so it may develop allergy, etc. like conditions. So therefore this option is wrong. Agni of the child is stable. It is not stable. Agni of the child is unstable during the Kshira Annada Avastha. So therefore the right answer for this question asked is which of the following sentences are wrong or sentence is wrong. So the wrong answer is C. Agni of the child is stable. This is wrong answer because Agni of the child is unstable during Kshira Annada Avastha. So this is the answer for the first question. Moving on to the question number 2. As for Kashyapa, child attains to speech and standing by dash. According to Kashyapa Samhita, child is able to talk or utter few of the words and also can attain the standing milestone, locomotor milestone of standing by the end of 1 year, 9 month, 11 month and 13 month. So this has been also discussed in the previous class also. So we will straight away go with the answer. The answer is 1 year. Tatra samvaksharat urdhvam upatishtati vachena prasrajati. This has been mentioned in Sharirasthana first chapter by Kashyapa very clearly. Okay, so answer for this question is 1 year, not 9 month, 11 month or 13 month. Moving on to question number 3. Which of the following is true regarding Shashti Graha? So Kashyapa also explains the Shashti Graha. The question is which of the following is true with regards to Shashti Graha? It is also included among the 20 synonyms of Revati, and Mallaka fish consumption causes Shashti Graha, and another option is 6th day of the Paksha, Shashti should be given offering, and the last one is all. So which of the following is correct answer? Which of the following is correct answer? One is definitely correct here. So therefore which of the following is true? You have to mention it. Let us see the options one by one. It is also included among the 20 synonyms of Revati. Yes, Shashti is also mentioned as one of the synonym of Revati Graha. So first option is right. Shashti is mentioned. Shashti, Bhadrakali, Matangi. So like that, many of the names were given. So which will go into Shashti Graha will go into kill the child on the 6th day of the life. It is clearly mentioned. Okay, after birth. So Shashti Graha is mentioned as one of the synonym of Revati Graha or Revati Jataharani. Now, Mallaka fish consumption causes Shashti Graha. This is also very clearly mentioned by Kashyapa. The consumption of the Mallaka fish by the mother, okay, Sutika mother. So that also leads to the appearance of a Shashti Graha. So this option is also right. 6th day of the Paksha, the Shashti should be given offering. Yes, this option is also right because Shashti Graha definitely on the 6th day after the birth in the neonatal life, 6th day, to minimize or to relieve the bad effects of Shashti Graha. So we should go for offering for Shashti Graha on the 6th day. This option is also right. So therefore all the 3 options are right. Therefore the answer is all of the above. Okay, so in this question the answer is all of the above. So we shall move to the next question. Question number 4. Which of the following is wrong? Which of the following is wrong? Now, Kashyapa gives more importance for Revati Graha. You have to say whether it is right or wrong. Kashyapa Samhita quotes that there are only 10 Grahas, but in reality, 13 Grahas are mentioned in presently available Kashyapa Samhita. Third one is, Revati has 20 synonyms and named as both Graha and Jataharani by Kashyapa. And last one is none. So one of the option is wrong. Now you have to say which of the option is wrong. Okay, so let us see the first option. Kashyapa gives more importance for Revati Graha. Yes, Kashyapa is the only author who has given more importance for Revati Graha. Therefore, he has mentioned 20 synonyms of Revati. Okay, 20 synonyms of Revati has been mentioned by Kashyapa. Revati Graha is mentioned by Vagbhata. Revati Graha is mentioned by Sushruta and so many other Lagutrais. Whereas it is only the Kashyapa who mentioned Revati Graha and counted it under Graha, and also the same Revati Graha will take the Rupa of Jataharani also. So this dual explanation is available only in Kashyapa Samhita. Therefore the first option is right. It is the most important for the Revati, most important Graha which is mentioned by Kashyapa is Revati Graha because he mentioned 20 synonyms. Now Kashyapa Samhita quotes that there are only 10 Grahas, Grahastu Dashakirtitaha. Okay, this is mentioned by Kashyapa, Grahastu Dashakirtitaha. But in reality, 13 grahas are mentioned in presently available Kashyapa Samhita. Whether this sentence is wrong or right. See, grahastu dashakirtita, this is very clearly mentioned by Kashyapa, no doubt. But if you look into the presently available Kashyapa Samhita, so we find 13, the graha number as 13. Okay, so whether this question answer is correct or wrong. Yes, this is also true, although he mentioned that grahastu dashakirtita, but if you count the number of grahas mentioned in the presently available Kashyapa Samhita, it turns out to be 13. Okay, some extra grahas are also mentioned, some here Shita Putana, then Kat Putana is mentioned, and then Vishaka graha is mentioned, like that. So totally we find 13 grahas. Okay. Third option is Revati has 20 synonyms and named as both Graha and Jataharani. Yes, Kashyapa is the first person who mentioned Revati as both Graha and as well as Jataharani. So this option is also right. Therefore, none of the following is wrong here. Okay, all the three options are right. Therefore, the answer is none of them. Nothing is wrong here. Everything is correct. Therefore, the question is the option is none. None is the right answer. Go to the last question. Which of the following is not a fatal outcome of Revati Jataharani? Revati Jataharani is mentioned in Revati Kalpadhyaya of Kashyapa Samhita, which comes in Kalpasthana, one of the very important chapter. Okay, so now the question is, which of the following is not a fatal outcome of Revati Jataharani? When the person is, or the women is get suffered by Revati Jataharani, which of the following is not happening, or which of the following is not a fatal outcome? Okay, so Revati will cause the menstrual disorders. Revati will cause so many abortions. Revati will cause stillbirth and stillborn baby. And Revati will cause neonatal death. Which of the following is not true or not fatal? Or in other sense, not true. Now, Revati Jataharani causes menstrual disorders. Yes, Jayamanasya Hanti. So, even in the Rutukala period or even before the marriage also, the Revati Jataharani may affect in an adolescent girl or a premarital girl. Okay, so therefore she has to take sufficient care to prevent so many intrauterine infections. Of course, to some extent, this Revati Jataharani we can compare with so many types of intrauterine infections. Okay, so now she has to take, because the infections which are occurring in the premarital period maybe turns out to be fatal during the pregnancy and later. Okay, so it can cause the menstrual Jayamanasya Hanti. Then abortions. Yes, Revati Jataharani is basically divided into three types: Yapya, that is Asadhya, Yapya, and Sukhasadhya. Okay, like that it is divided into three parts. Okay, so these abortions, so they comes under the Asadhya type of Revati Jataharani. So Andagni, Falagni, Andagni, and then Karkotaki. So like that, many types of different types of the Revati Jataharani are mentioned. So it also definitely causes abortions. Then it causes stillbirth and stillborn. Yes, this is also true. Lastly, neonatal death. Even Revati Jataharani can cause the neonatal death afterwards. First day it kills the baby, second day it kills the baby, third day it kills the baby. Like that, big list is given for Revati Jataharani. Therefore, here, which of the following is not a fatal outcome of the Revati Jataharani? Now we have to think which is not fatal. Abortion is definitely fatal. Stillbirth is also fatal. Neonatal death is also fatal. But compared to the menstrual disorders, okay, compared to the other last three, menstrual disorders are not so fatal to although she is afflicted with the infection, may be fatal in the future. Presently, it is not much fatal to the existing lady or the adolescent girl. So, although all the four are correct, we can, according to the question, as it is asked, not a fatal outcome. So, we can say that menstrual disorders, which is caused by the Revati Jataharani, is not much fatal compared to all the three. So, this is all for today. Thank you very much. We will meet in the next class. Hope you will subscribe to my channel, and thank you very much.